So I'm going to get started with day 6. It's going to be a bit chaotic because I'm in London. But what do I want you to focus on today's session? So first thing is, if you remember, endocrine system and corticosteroids, there's a few things. These are all the videos that I want you to watch. So corticosteroid responsive conditions, what could happen with prolonged use, prolonged use, or which routes of administration are you worried about with central serous chorioretinopathy, the different types of corticosteroids, the difference between glucocorticoids and mineralocorticoids and their side effects, and treatment cessation. Understanding treatment cessation is incredibly important because you can easily get a question on this in the exam, and then understanding the thyroid gland, so anything in relation to the thyroid gland and its treatment, and then calculations. So calculations module 3, which includes 12 calculation examples, one from each type of calculation. I'm going to include a video webinar that I did recently, which is not, it's more of an introduction to the GPhC exam, but it's all the common mistakes people made in the GPhC exam, and I think you will find it very useful. But again, I do want you to do some self-directed study with these topics as well. We'll give it a few minutes before we'll start about 9:05. What we're going to go through in today's session, has anyone, just let me know in the chat, has anyone started watching the YouTube series? Yes. Anyone else? Yeah, so someone has said, I thought it was live, so kept commenting. But the person who wrote that, I saw your messages. So I tried to respond. So it wasn't live, it was a recording, but I was there on the other end. So anytime you'd ask, I think I responded to a few of your questions because I was actually there responding. So I was watching the live with you all. Someone else said, is the YouTube series directed at students doing November? So it's a 70-day series, and it's to help people who are sitting in November because of the relatively high fail rate in preparation for the June assessment. However, it's useful for even if you're sitting in June. Because what I want it to be is I want it to be something that can stay around on YouTube for a few years. With regards to, someone said, is there a group chat in which we can discuss the exam or pharmacy knowledge? We've got 2 group chats. They're on Telegram and WhatsApp, but they're not a chat per se. They're more so just for me to let you know what's coming up. So I'll share that in this. I'll share that in this session whilst we're watching. Is it more condensed because the exam is sooner? So there's 2 factors, right? It was a lot, basically a lot of the program is behind the membership. So it's for a lot of the programs available for members only. So the YouTube series, I did a combination of things. What I do in that series is I tell you essentially how I would tell if someone was on the Pro Plus Mentor membership, I tell you what I would tell them to study, and I tell you, if you're a member, what videos you have to watch. However, if you're not a member, then I tell you what you should study, and at the same time, I include some webinar recordings. So like yesterday's one was an hour and a half. However, I wanted you to do a 3 hours worth of studying. So that hour and a half makes up half of your study time. And then I tell you what you should study beyond that webinar. So it's I would call it a guide with some free bonus material included. If you have the membership, it will literally guide you through the membership. I'll tell you which modules and web and recordings to watch from your membership. Would you say that 6 weeks before the exam is enough to properly start revising for the November assessment? No, is my simple answer. You can do it. I'm not saying this isn't to discourage anyone, but I would say you're leaving it far too late for your revision. So you're not giving yourself enough time to prepare. So you don't put yourself in a good position for the exam. So even the 70-day program, I say it's not ideal. However, if you stick to this plan, and what I would roughly say is the people who I mentored, I spent approximately, I spent with there's one particular student that I mentored that he doesn't mind me using him as an example. He got 109 out of 120 in the clinical paper and 34 out of 40 in the calculations paper. I started preparing him for the exam in October in preparation for the June assessment. Bearing in mind, we know we're going to take things slow in terms of preparation. And he completed all of his studies at the start of April and then just started re-revising the content we went through from April leading up to the June assessment. In terms of the directed study of me leading creating his study plan for him, everything I told him to study took him 140 hours in terms of study time. That's bearing in mind that he then had April all the way until June to revisit everything that I taught him. And in as a rough estimate, I say at least 210 hours of study. People differ in terms of how well they can prepare for exam. Like, for example, I've got 9 people I am mentoring leading up to the November assessment. So that's signed up from 2 weeks ago. So I'm mentoring 9 trainee pharmacists that didn't sign up to MicroPharm and did not pass in the June assessment, and they're preparing for the November assessment. So with regards to that, so with regards to that, I'm mentoring these 9 people, and what I find is I tell these 9 trainee pharmacists to study a particular topic, but when I test them, when I meet with them one-to-one, people differ in terms of their performance, and they're studying the same material. So you need to take that into mind as well. So this is a very important question, and this is something that really bugs me with the way people talk about how to prepare for the exam. When I can share with you my experiences of when I started studying, but I don't think they're as relevant anymore. I passed the exam in 2017, but in that process from starting MicroPharm 4 years ago to now, I've taught 5,000 trainee pharmacists, and I've mentored trainee pharmacists one-to-one. So when people say, sometimes people rave about what they can offer you for the exam because they say, I did really well 6 years ago, which I think from a training provider, like if I'm going to a training provider, I don't want to know what they did 6 years ago, but I want to know what happened with the students that they taught. So quite often, if I give you examples, it's from people I've taught and that have passed the exam as a result of my teaching. But in terms of when they start, we have differences in terms of we have some members that start in October, November. We have some members that started 3 months prior and passed the exam comfortably. So people differ in terms of the amount of time they need to prepare for the exam, but people also differ in their studying abilities. Some people are able to grasp content much quicker than others. Some people have better study techniques and therefore are able to get through content much quicker than others. Any other questions before we get started? I've got one question. Is the revision plan provided with ProPlus similar to how you structure learning with your mentees? It's similar. Yeah, so it's similar. What I can do is while you're there, for example, I will show you the study plan that I had with one of my with one of the someone that I mentored. So just bear with me. I will share my. Okay, can everyone see that? Now I can't see the chat. Can everyone see that? Yeah, so this is one of the trainee pharmacists that I mentored in preparation for the June assessment. He passed with this is the example I was using. This is Diego. He passed with 109 out of 120 in the clinical and also 34 out of 40 in the calculation paper. We started on the 2nd of October. I set his work weekly. So I told him exactly what he needs to study every week. As you can see in the roadmap, I tell you what to study every month. So I set his 4-week plan and I met with him monthly. The main difference with the mentorship is I will look at what he studied, I will look at how he grades what he studied, and I will also test him on that material. So I create a bespoke test every time I meet with him to test him on the material that he's covered. I tell him his weaknesses and I tell him what to focus on later on. This is the study plan we did. We gave him a little break there for Christmas. This is the study plan that I did with him weekly leading up to the exam. So this is included if you just sign up to the Pro Plus mentor membership. So planned all of his stuff all the way up until the 7th of April. This was something that he wanted to do, so I can make that study plan however you want it to be. So how intense do you want that study plan to look like? When do you want to finish your studies? He said, I want to finish as soon as possible, meaning I don't want to be studying material all the way up until the start of June. I want to finish all of that material start of April. He initially said end of March. Then he initially said March, and then he said end of March. Because I told him it's going to be intense. So we planned for the first week of April in the end. He had done all of his content over a period of 140 hours that I directed for him. And then it was his responsibility to relearn the material leading up to the assessment. And what I did is I would meet with him regularly leading up to the assessment to do spot tests to see how he's getting on with a mixture of questions. So he didn't know what I would be questioning him on. So hopefully that gives you a better insight of it gives you a better insight of what's included in the Pro Plus mentor membership. In terms of overall pass rates, I have completely lost the share screen slide. In terms of overall pass rates, I found it. In terms of overall pass rates, 98% of our members that completed the program passed the assessment. 100% of those on the Pro Plus mentor membership passed the assessment. Okay, let's start with the material for today. Okay, so today is going to be an introduction to the GPhC exam. I'm going to be going through some pointers when it comes to. I'll go through some pointers when it comes to the exam. I'll go through the feedback, how people performed in the June assessment. I think it's important for you to know that. I'm going to go through what the people struggled with in the June 2024 assessment. I'm going to go through the mapping of what percentage included high, medium, and low weighting material. And I'm going to go through learning points from the assessment. Does anyone have any questions before we get started? Um, and someone asked, if I'm a member for Pro, can I add money to become a Pro Plus member? Yes, absolutely. Best and easiest thing to do is just send me an email at info@micropharm.org. And just let me know your details for who you are. If it's the same email address, it's pretty easy for me to find out who you are. I'll send you a payment link for the difference of the price. There's no admin fee or anything like that. I'll send you a link for the difference of the price. And once you've paid the difference of the price, I can upgrade your membership. Generally, it give me about 24 hours, but if I'm awake, I can upgrade it. I can upgrade it immediately. Okay, so why did I create MicroPharm is a very important question. So one thing that I found was essentially preparing for the registration assessment was I found incredibly difficult during my time. And that's primarily because of the fact that a lot of us no longer use textbooks. How many of you, it'd be interesting to see how many of you actually use textbooks while you're studying at university, like the big chunky textbooks? No, I never did. Okay, so I'm a lecturer, and when I tell other lecturers that I've never used a textbook, they seem to be in shock because they recommend like a billion textbooks at the start of the year. One thing that's really interesting about the textbook industry that a lot of people don't know is I'm not sure if you know, but lecturers can actually apply to publishers to get textbooks for free. So most of the textbooks that lecturers receive, they can actually get it for free because they're a lecturer. I'm not sure, did anyone know that? And primarily because of that, they give you these free textbooks because they actually want you to recommend these textbooks to your students. So that's something that I learned when I first started going into lecturing. But I've never used textbooks. Student textbooks spending continues to decline. Um, a lot of publishers are starting to see that there is a decline in textbooks and they need to change the way they approach education, essentially. Has anyone used Osmosis before, the platform Osmosis? Yeah. So Osmosis was, did anyone see the information about Osmosis being recently acquired? So a huge textbook company called Elsevier, they acquired Osmosis. They paid a lot of money to buy Osmosis. Osmosis is a video platform. It's really what inspired me to go into the pharmacy education world. And essentially, they bought Osmosis because they realized people are actually, rather than buying textbooks, people are going to platforms like Osmosis to learn and study. And that's when I said this is a very important space for the pharmacy world. So 60% of students prefer videos over textbooks. And one of the main barriers to entry when I was in this space 4 years ago was the cost. One of the challenges was a lot of trainee pharmacist platforms were face to face. I was with a trainee pharmacist platform that had 10 study days that were face to face. That was very difficult. And what they did was like the entire day was dedicated to infection and another, let's say, cardiovascular system. So you're learning two high weighting topics face to face on the same day in the span of 7.5 hours, which to me was just bonkers. Like I didn't absorb any of that information. In some cases, we're learning that material 9 months before the actual assessment. So it's 7 hours worth of high weighting material, and then you're expected to self-learn at the end, and you're not allowed to have any recordings or access to the recordings. And I paid £1,500 for that membership. With VAT, it's £1,800. So some of those courses are face to face, some of those are incredibly expensive. So that's when I said it's important for me to have a membership in this space. And one of the important aspects of my membership that I really wanted was a money back guarantee to say we're so confident in what we offer. If you complete the entire course, if you go through all of the questions and answer them correctly at least once, and you do not pass the exam, I will give you your money back. So the reason why I thought that was important is it shows you how confident we are in what we offer. I'm going to show you what the membership looks like because we're going to go through some infection-related questions in this session using the platform. So the Pro Plus membership has over 400 bite-sized videos, over 850 interactive quiz questions. We're on the road to 1,000, so we will be at 1,000 soon. We're hoping to hit 1,000 questions by the end of September. We have 30 live webinars per year. 20 are in accordance hosted by MicroPharm. 10 are in association is MicroPharm in association with Morph Training. And only members get access to those recordings, and we have a community space where you can chat with each other with peer-to-peer learning. This is our team, and this is something that was incredibly important to me when creating a trainee pharmacist platform. Our team consists, this is 12 out of the 16 people that teach on our platform. We only have people that are highly specialized in that area to teach a particular topic area. I'm not going to teach you a topic area that is not my area of expertise. We have several members that work for NHS England on the platform as well. So we have a team of 16 members, and those that are highly specialist in that area teach that particular area. So you've got Sana, for example. Sana works for NHS England. Elaine teaches genitourinary system. Nirali is highly specialist in the cardiovascular system. She has a secondary and primary care specialist background in the cardiovascular system. She teaches the cardiovascular system. Adi, he actually works as a lecturer at the University of Bath. He teaches OTC and consultation skills, and he does like to teach some calculations. So he teaches one of the modules in calculations because he really enjoys calculations. Basra is he's a specialist in mental health, and she teaches the CNS chapter. So it's the same story with the rest of the members. So I thought it was incredibly important to have a team that holds varied expertise within their specialist area. So we have a stronger team when it comes to teaching you for the exam. We've taught over 5,000 trainee pharmacists in the past year alone, 1,227. We have over 200,000 followers on the platform. This is the roadmap that I was referring to. And this is what we use to direct our trainee pharmacists of what they should be studying. As a guide, you don't have to start in August. This is only for people who like that structure. So let's go through the statistics. Has anyone taken a look at the statistics for the June assessment? Even if you're sitting the exam next year in June, I think it's incredibly important for you to look at these statistics. Has anyone looked at these? No is okay. No, the answer saying no is fine. Yeah. No? Okay. So 2,776 people sat the assessment in June this year, of which 2,081 passed the assessment, 695 did not pass the assessment. That was a relatively high fail rate for the June assessment. I say relative. I've given you the figures here for June 2023. In June 2023, you can see that 77% of the cohort passed the assessment and 23% failed. So you can see in terms of the numbers of failures, there was 695 this year and 655 last year. It wasn't a significant drop in terms of the number of people passing the assessment. I want that to be clear, because I think there was a surprise when it comes to failure rates, but at the same time, I want people to have some optimism with the fact that it wasn't hugely different from the previous year. In terms of the breakdown of people sitting the assessment, this breakdown is very important because those who didn't pass the June assessment and are in this webinar will find these figures useful, because the number of first-time sitters within this assessment, it was 88% of the assessment consisted of first-time sitters. 8% consisted of second-time sitters. 4% consisted of third-time sitters. Now, this is important because when you come to these figures here, can you see over here the number of first-time sitters that passed? It was 77%. The number of second-time sitters that passed, it was 53%. And the number of third-time sitters that passed was 59%. You can see that that percentage pass rate drops if people are sitting it for the second or third time. Now, this was important because there was just some figures that I wanted to quote to you as well. Just bear with me. This matters because the number of people sitting the assessment again in the November assessment. So let's take November figures, for example. In the November assessment, there was 1,000 people who sat the exam. The overall pass rate was 66%, but the number of first-time sitters, what percentage do you think in the November assessment was sitting it for the first time? Someone said 80%. Privately, anyone else hazard a guess? Yes, 48%. 48% was sitting it for the first time. 52% was sitting it for a second and third time. So when people refer to, people often are scared about the fact that pass rates for the November assessment are lower than the June assessment. But you have to bear in mind that the cohort of people that are sitting the exam are vastly different. They're not comparable. And June assessment figures tend to remain the same in terms of pass and fail rates. So what the GPhC argue, and to some degree, I would agree with what the GPhC argue, the cohorts are vastly different, and therefore the cohorts determine the pass rate. Does that make sense to everyone? So essentially what I'm trying to say to you is they're not out there to get you for November. And bearing in mind, I do not work for the GPhC. So they're not out there to get you for November, and it's very possible for you to pass the November assessment for those of you who are sitting the November assessment. Okay, just to give you a brief background of myself, I work as an honorary senior lecturer in pharmacy practice. I had to step back from my senior lecturer role to become an honorary senior lecturer, and that's primarily just to give me some more time to manage MicroPharm. I work 2 days a week for the NHS as an advanced specialist pharmacist. I was working there today. I work within the specialty of interstitial lung disease, but my areas of specialty when it comes to teaching are infection and endocrine system. I'm a visiting lecturer for the postgraduate pharmacy clinical pharmacy diploma, and in particular, I mark for the antimicrobial resistance module. And mainly my role is, and my weeks consist of MicroPharm when it comes to teaching trainee pharmacists. So I've taught over 5,000 trainee pharmacists so far. So has anyone looked at the GPhC exam framework? Yes. Nope. If you haven't, it's not a problem. Particularly if you're sitting in June. If you're sitting in November, I would have presumed you've already looked at it. So there's 2 papers. There's part 1, which gives you've got 2 hours to complete part 1. It consists of 40 calculation questions. Are those answers for those questions, are they multiple choice or are they free text? Yes, free text. Yes, they're free text, so you have to write out the answers for those 40 questions. For part 2's, the part 2 paper, sometimes this is called the clinical paper. They don't like to call it the clinical paper and calculations paper because you can get some calculations questions in the part 2 paper. It consists of 120 questions. 90 of those are single best answer. What is single best answer? What does that mean? Exactly that. So they're multiple choice, but there can be more than one correct. They can be like that. This is the one thing I want you to understand. Is there can be more than one correct answer. It doesn't necessarily mean because there's a common misconception that all five will be right, but oh, you can only pick one that's correct. That's not the case. There can be more than one answer that's correct. Doesn't necessarily have to be, but then you have to select the most appropriate answer. If you're like this happens with me. The reason why this is important, when you're coming into the pharmacy world and a patient says to you, I experienced diarrhea. What medication do you think is causing my diarrhea? And they're on 10 medications. Do you think only one could be causing their diarrhea? No, there's a huge variation in terms of there could be multiple medications that relate to even when it comes to treating patients, there could be multiple there could be multiple medications that could treat the patient, but one's more appropriate than the other. So that's the reason why the single best answer format makes the most sense for a pharmacy exam. So because you'll sometimes a medication can cause tinnitus, but one is far more likely to cause tinnitus than the other. And this is what practice looks like, right? You have to look at the likelihood of what's most likely driving a patient's side effects, for example. Calculators permitted for part one, not permitted for part two, but there may be calculations and questions in part two, but you're expected to calculate them without a calculator. Someone asked the question, do you give calculation questions with units as well? Absolutely. Currently, we have in total 170 calculation questions on the platform and soon to be 270 calculations on the platform. We're currently in the process of adding 100 more questions. 70 of those calculation questions are videos with the answers and rationales there with you. 100 of those are for you we give multiple choice, but the reason why we give multiple choice with our questions is just so we can track your progress. So for the first 100, it'll be multiple choice. The next 100, it'll be free text. So that allows me to track how well people are performing. We give with all the calculation questions we always provide rationales for all of them. Some are video rationales in 70 of those videos, and some from the 100 questions are written rationales. Okay, so let's go through the assessment. So the relative importance of certain outcomes is graded. So let's go through high weighting material. I'll go through rounding up as well. Okay, so when it comes to the assessment framework, what consists of high weighting? Cardiovascular system, endocrine system, infection, and CNS. Absolutely. So those are your high weighting materials. They make up 60 to 70% of your exam. So what do you think I'm going to tell you when it comes to how much time you're using to prepare for the exam? Spend far more time. If you want a guidance of how much time to spend on each side, this is your guidance. 60 to 70% of your time you should be spending on high weighting material. 25 to 35% is medium weighting. What consists of medium weighting? Genitourinary, musculoskeletal is low. It used to be medium a long time ago. When I was sitting the assessment, they dropped it then to a low weighting topic. Genitourinary, respiratory, gastrointestinal tract, immune system in malignant disease, blood and nutrition as well. So that makes up 25 to 35% of the assessment, and low weighting makes up to 10% of the assessment. So we've gone through that. Medium weighting, genitourinary, gastrointestinal, respiratory, immune system, malignant disease, and blood and nutrition make 25 to 35% of the assessment, and low weighting are these 6 topics. I thought the junior exam was a mix of everything. That's a fantastic, fantastic question. Because in essence, it is a mix. Because what they say, I'm not sure if I think I've got the point. Yes. So questions may relate to more than one topic area. Let me give you an example of that. If you're treating a patient for athlete's foot in community pharmacy, what topics, therapeutic areas, and what other topics do you think they relate to? So what does it relate to? An athlete's foot case, for example. Infections. And in particular, if the patient's diabetic. So people are saying endocrine system, but that's only if they're, and OTC as well. So OTC is a strong part of the framework. It's not written as a therapeutic area, but roughly speaking, you can have like 10% of that paper can be OTC questions, but they're related to a patient with infection, for example, a patient with a sty, for example, a patient with signs with chickenpox, for example. So that's related to skin and OTC, and also infection. So questions can relate to more than one topic area, but there generally is a leading therapeutic area for each question. But they do stipulate percentages for what, like, if those cases are mostly infection, they will stipulate percentages of what the exam was made up of. And I'll show you what that looks like for the June assessment. I've got those figures in this webinar. So in terms of low rating therapeutic areas, you have got the musculoskeletal system, eye, ear, nose, and throat, oropharynx, skin, vaccines, and anesthesia. All these 6, how much of the paper do you think they made in the June assessment this year? All of these 6 topics. Eight percent. 8%. So it's up to 10%. But it was actually, it was 8% for this paper, which is what the GPhC reported. Take that into consideration. If you're spending, I know people who've spent the first 3 months just studying low weighting material and not even touching high weighting material till January. Don't be like that. Focus on your high weighting material first. It's your priority. You rather go through your high weighting material twice than go through it once just because you want to cover low weighting material. Ideally cover everything, but if you're short of time, know your high weighting material the best. That gives you your highest chance of passing the exam. Okay, these high risk drugs, why are they important? No, not necessarily, because this high-risk drug list is made by the GPhC, so it's not necessarily to do with TDM. There are drugs with a narrow therapeutic index included in the high-risk drugs. Essentially, what's their significance for the exam? Someone's put it as a private message. So at least one question of these, at least one question from each of these will come up in the exam, guaranteed. But, and I've said this before, if you're considering insulin, there could be several questions related to insulin in the exam. There could be several questions related to antibiotics in the exam. It's just they're saying to you, you need to know these. Well, calculations, there's 12 different types of calculation questions that can come up in the exam. We cover all of these thoroughly multiple times. So in the video format, we have 5 modules where we cover each type of these questions. So we have 5 different video examples of each of these. And then we also have 100 questions, soon to be 200 questions that are related to these 12 topics. That's how we prepare you within the MicroPharm membership. So let's take some insights from the June assessment. The passing score for the calculations paper was 25 out of 40 marks. Has anyone said to you that the pass percentage for the GPhC exam is 70%? Has anyone ever said that to you? Yes. Does this match your 70%? No. So this was 63% to pass in the calculations paper and 69% to pass in the clinical paper. It will differ every year. So just take that on board. They will look at how people perform, they will look at the wording of the questions, they will look at how people performed in each question, and the distribution of where people's marks were within the paper. There's so many factors that they will take on board before they determine the passing score for each paper, and it will change every year and for every exam. So just take that on board. Less people passed the calculations paper than the clinical paper. And from the feedback that I've had and the one-to-ones I've had with people who wanted to meet with me, after they failed, what I did was after the June assessment, I gave free consultations to anyone who failed the assessment, regardless of what platform they were using, to essentially see how they prepared for the exam, and they wanted to know what MicroPharm offers. So in those meetings, I would tell you from my own personal experience, the majority of people that I met with had failed because of maths. And someone said in the chat, failed by a mark. You're not the only one. I've spoke to at least 5 people that failed by a mark, which is horrendous. And the best and most important thing that you can do is lots of preparation and lots of timed preparation in terms of calculations. One thing I found was what people fed back to me was calculations. They essentially, a lot of people ran out of time, and it was a lot more intense than they expected. So the only way you can best prepare in that department is to do lots of calculation questions and give yourself time constraints. Looking at question distribution, 67% of the questions were high weighting material. So they could have gone to 35% with medium weighting. They stuck to about 25%, which is the lower threshold, and 8% was low weighting material. Again, just reinforcing what I said to you about low weighting material. In terms of preparing for the assessment, what I would say is focus on the high weighting material. It's the majority of the exam. Familiarize yourself with the question style and format for the assessment. So one thing that I do is we go through different assessment types of questions. I cover several webinars where I go through extended matching questions and also single best answer questions. I forgot to mention this in the previous slide. I had it on the notes, but I forgot to say 30 of the questions in the clinical paper are extended matching questions. So this is where there's several questions. There's one base for the question, and it will tell you a topic. So let's say the topic can be infections, for example, and then you get a question relating to infections. So you get a case study about a patient, but then you have multiple questions. You have 8 options in terms of answers and multiple questions to pick from those 8 options. From those 8 options, you can pick one option more than once. Many options you may not pick at all. You may not pick at all as well. So it could be you're picking one option from the 8 for every question, or you could be selecting the same option for more than one question. There's nothing stopping them from doing that for the assessment. Candidates often miss mark by not providing practical real-world solutions. This is a common mistake when it comes to calculations, where let's say you're calculating the number of insulin pens that a patient requires. If you're calculating the number of insulin pens that a patient requires, if it's an unrealistic answer, check those before you submit those answers. So a significant number of candidates did not follow specific rounding instructions, leading to incorrect answers. So sometimes they will say, give the answer to the nearest whole number. Sometimes if you're calculating the number of tablets that a patient needs daily, it may be worth rounding up to whole tablets and then adding those numbers together to calculate the total number of tablets a patient needs for the duration of their treatment. And that's in particular, those rounding up, knowing when to round up is what people often made mistakes on. We'll go through several calculations webinars in preparation for the exam, so you can have a good idea of what those knowing when to round up. Yeah, so one of those examples, like I said to you, is total quantity to dispense. If you're calculating the daily dose and the daily number of tablets, let's say, of prednisolone a patient's receiving, it's not going to be 4.7 tablets every day. It's going to be 5. If you multiply that by the entire duration, then that's going to lead to inaccuracies. But Enketia, who leads on calculations, can go through this further with you. In terms of calculations, webinars are free. The recordings are for members only, and everything else I said is for members only. Understanding practical aspects of dosage is critical. So let's say sometimes ampules are single use only, so you cannot calculate it as using the same ampule for 2 days, for example. You have to take that into consideration. And effectively using the resources and being able to use the functionality of finding in the document will save you time. So if you're limited to time. One thing that I would say is you have the sample questions that are available on the GPhC website. So with regards to those sample questions, it's very important for you to, with regards to those sample questions, it's very important for you to make use of those. Did anyone sign up to Locate a Locum and get the free clinical ebook that I gave? Yes, does anyone not know about it? I was giving out 50 free questions. So this is the link. It takes you 2 minutes. Locate a Locum sponsor all of our webinars. It takes you 2 minutes to sign up to Locate a Locum. And what you'll get is I will email you within 7 days of you signing up 50 calculation questions, an ebook with 50 and not clinical 50 clinical questions, and I will email you 50 clinical questions, and also you'll get £40 for working your first shift. Drop me if you signed up and you didn't get it. I've already emailed the last lot, and so if you didn't get it and you emailed a while ago, drop me an email at info@micropharm.org. Here's the link. Yeah, but you have to sign up with this link because it's a trackable link. So this is the only way people know that you signed up via myself, and that's the only way you get the ebook, and that's the only way that you get the £40 for working your first shift. Oh, sorry. Did I not? I think I shared it individually to someone. Here you go. Yeah. So please sign up using this link in particular. It's a particular trackable link, so they'll know that it came from myself. It takes you 2 minutes. It's definitely worthwhile getting the 50 questions. Okay, so let's go to part 2 preparation. So part 2, again, sometimes called the clinical paper, systemic corticosteroids. Many people are unsure about appropriate dosage adjustments, cessation protocol. So you can't just stop prednisolone, for example. Why can't you stop prednisolone abruptly? Does anyone know? We'll be finished in the next few minutes. Someone said adrenal insufficiency or adrenal crisis. Yeah, in simple terms, what does that mean? In simple terms, prednisolone suppresses your own body's ability to make its own type of steroids, which is called cortisol. And therefore, if you abruptly withdraw it, you may not have enough circulating cortisol for your body to function, and you can go into adrenal crisis. So there are certain circumstances where you should wean more slowly and where it's safe to stop the prednisolone. So understanding the differences based on the different conditions is vital. Asthma management, so confusion around steps with acute and chronic asthma management and adjusting care levels and knowing the high-risk drugs, which we went through already. So cardiovascular disease, there was evidently gaps in knowledge regarding the management of cardiovascular conditions, particularly in those preventative measures and emergency responses. Pain management, people struggle with differences between pain and recommending appropriate treatment. Where does pain fall in the BNF? And breastfeeding and menopause, this happens every year. People make CNS, absolutely. And people often make mistakes when it comes to breastfeeding and menopause. So knowing about breastfeeding, knowing about treatment of conditions during breastfeeding like mastitis is very important as well. So what I'm going to do, has everyone seen the MicroPharm membership and what it looks like? Yes. Does anyone want to see it? Yep. Okay. Someone messaged private. I'm a Pro Plus member. Uh, I definitely recognize your name. So, in terms of how to prepare for the exam, study plan. So prioritize your high weighting materials more so. You've got free MicroPharm webinars to attend. I'll release a guide on what webinars we're going to cover every month, and I'll release the dates closer to the time. Because like days like today, when I was needed for on call, it's like I only get these decisions last minute. So I'll give you a rough time of when they'll be, and I'll give you a few weeks notice prior to each webinar. Okay, so let me show you what the membership looks like. So a lot of questions. Sorry for the confusion early. I want to upgrade my membership to Pro Plus mentor level from Pro. Is that possible, especially if I'm sitting in November? So if you want to go to the Pro Plus mentor level and you're sitting in November, it's possible. It will mean that we'll have to cram those 12 meetings into the space of just over 2 months, which again is possible, but it's intense. If you want to do so, just drop me an email at info@microfarm.org and let me know that you want to upgrade to that. And I think the most important thing is you have to, I'm going to set a plan that will mean that you have to revise 3 hours minimum per day. If you can do that and keep up with that intensity, it's not a problem. But you're in a good position because everyone that I'm mentoring in preparation for the November assessment that's newly signed up over the past 2 weeks is not in work because they've done their training hours. So if you're in that position, you can dedicate 3 hours a day minimum in terms of studying. I'm more than happy to set those plans in place and get you up to speed with where everyone else is. So if you want, just drop me an email, info@microfarm.org. Someone asked for this slide, so I've just popped that on. Is there going to be any spaces available at the end of November to join the Pro Plus mentorship? Uh, yeah, possibly. I try to limit the number of spaces because of the fact that let's just take this month, for example. We have had 3 times the number of signups that we had this month last year. And what I do with all of those members that sign up is I send them instructions how to set their Pearl Pro membership up, which is free with their membership, how to navigate their membership, and I offer free one-to-one with every single member that signs up. So it's just in relation to time constraints. So I can't tell you in terms of how many students I know I will be mentoring for the rest of the year. Because that's bearing in mind that I have to meet with those students and create a study plan for them, a one-to-one study plan for them every month. So it's possible that I won't have capacity at the end of November. So I can't promise anything. Just a quick question, no need to answer. I've bought the Pro Plus membership. Is everything I need to know in the course, or would you say I need to study further? For example, NHS treatment pathways, strep throat. Okay, so we have many people who sign up to the Pro Plus membership, and it's the only resource they use. One thing that I would say if you signed up to the ProPlus membership is use everything that's in the membership. So we give you 18 study guides to use alongside the videos that we provide to you. And those study guides will have nuances and MHRA warnings to supplement everything that's covered in the webinars. So these will be covered in the webinars. If there's 6 MHRA warnings for a particular medication, there's like a whole bunch, for example, fluoroquinolones. All the details for that are written out really well in those study notes for you. So utilize all the resources, and that should be enough for you to prepare for the exam. Again, bearing in mind you've got 850 preparation questions, go through all of those and make sure you go through them multiple times in preparation for the exam. Let me show you, I'm going to show you what the membership looks like while you're here. Okay, so can everyone see that? I'm just going to answer some of the questions as well. Would you say November shouldn't be too different from the June assessment? Generally not. Generally not. In terms of the paper, in terms of changes, so we always review our material regularly. You may get some changes with regards to MHRA warnings. Sometimes guidelines change. So we provide you with updates of what guidelines have changed. But the majority of the content and the framework tends to stay similar and the same. If you are a member, you will get this recording added to your platform. I'm going to stop the recording.